What we're bringing is a telemedicine program, which means that we are using technology to bring healthcare to the schools. And in this case, what it means is real-time video conferencing with some exam capabilities. The school nurse might initiate the visit, or the parent might initiate the visit. But what they'll do is there'll be a concern, say it's an earache, and they'll notify the parent and say, do you want the child seen in the telemedicine clinic? And then they'll set up a time for me to see the child with the school nurse. And then they'll use a special camera to look in the child's ear, and I'll look and see if there's an ear infection or something else. And then, depending on what we saw, we'll call the parent back, or sometimes the parent will come in and sit for the visit. They're very welcome, but often these parents can't. And we'll communicate with the parent and go over the story, make sure it's the right story, and then we'll decide to prescribe an antibiotic or something, decide if the child can stay in school or not. It's very similar to just doing Google Plus or FaceTime or something like that, except you have special devices where I can listen to the heart and the lungs, or look in the ears, or look down the throat, high definition images of a rash. And in some cases, using this equipment is better than when I see a kid in my office regularly.
There'll be a lot less time out of school, quicker turnaround for them to get their medicine and get started with treatment, and less time out of the classroom.
There's certain areas in the state and certain children that have a hard time getting to health care, and the numbers show that. They show up in the emergency room all the time and they don't go to their doctor. And when they do show up in the emergency room in the hospital, they're sicker. So it's obvious that they're having a hard time getting just regular preventive care or chronic disease management. And so we can bring that directly to the child. It's kind of a no-brainer when you look and you see that there's poor children living in a rural area, no doctors around. How are you going to get health care to them? Well, they all go to school, and they all get bused to school, so why not bring the health care to the school? The problem with that is it's hard to sustain those programs. When you have a doctor or nurse practitioner drive to the schools, it's hard to sustain that. But in this way, the provider can be in one location and see multiple schools and multiple children, and you can make it more sustainable, and you bring the care right to the children.